Welcome, everyone. I'm Colette Courtion, the CEO of Joylux, and I am so excited to be here with my lovely colleagues here to talk about women's health. I'd like to start by doing just a quick introduction of everyone. As I mentioned, I'm Colette Courtion, CEO of Joylux. We are a women's health company offering non-invasive, non-hormonal solutions for women as they are going through menopause. Jill, I'm so excited to be on this talk with you. You and I go way back as some of the early pioneers in the space of menopause. Please share a little more about you and the company.
Absolutely. It's great to be here, Colette, with you and yeah, on this journey with you as we've continued to really try to innovate and change women's health. I'm Jill Angelo. I'm the founder and CEO of Gennev. And Gennev is an online virtual care provider for women in menopause. We think about women in their post-reproductive years, providing telehealth-based clinicians as well as health coaches who are dietitians. And I'm excited to have a colleague of mine here today to join us on this panel. But again, really always very excited to talk about this topic of menopause.
Great. Why don't we continue with introductions? Dr. Sarah, jump in.
Go ahead.
Yeah, hi, I'm Dr. Sarah. I thought Stacey was going to go. I'm sorry. I'm Dr. Sarah. I am the Chief Medical Officer of Joylux, and Colette and I have worked together for several years, perimenopause and menopause years, and I'm just really excited to be here with a group of you.
Excellent. Thank you all for your introductions. I'm Kasianchuk. I'm Gennev's Director of Health Coaching. I'm a registered dietitian and exercise physiologist, and I oversee our team of dietitians, and we support women on the lifestyle side of menopause symptom management. And we'll talk a little bit more today in our discussion how we collaborate with our OBGYNs as we provide an integrated plan to support women from all aspects of their health.
Great. Well, I want to dive right in, but before we start getting into these awesome questions here, I want to remind the audience that if you have any questions yourself, please feel free to add in the chat and we'll get to it here shortly. Also want to let everybody know that at the end of this awesome talk, there will be some special promos for anybody listening. So stay tuned to get the codes for a special offer from both Joylux and Gennev. So let's jump in right now. And Dr. Sarah, you are an esteemed OBGYN here. So let's just start off with estrogen. Let's talk about estrogen and the effect of declining estrogen on the vagina and our vulva.
Sure. I love to talk about estrogen. It's one of my favorite hormones to talk about. Estrogen, we have it, from when we're first born, gets increased during puberty and stays pretty steady during our reproductive years. Every cycle, it varies as we go through our cycles of our periods. But as we get closer to menopause, and certainly as early as our late 30s and early 40s, women can start to notice declining estrogen levels. And this can be whether they're having regular cycles or not. Our egg quality decreases as we get older, and so that's what produces estrogen, or our eggs. And so as our estrogen levels decline, we start to notice that we have thinner tissue in our vagina. We might notice dryness or irritation of the vulva or the vaginal tissues. This can lead to discomfort, irritation, certainly pain with intercourse. So these are the symptoms that can happen. Mood-wise can be affected too by varying levels of estrogen. Our bone health, lots of ways that estrogen plays a role in our body, but specifically in the vagina and the vulvar tissues, estrogen keeps it plump, thicker tissue, more lubricated, and we can start to notice those changes as we get older.
Dr. Sarah, you were starting to talk about a little about painful sex. You mentioned that having to do with your vaginal health. With that, when do women start to notice this and notice low libido and all these things that women experience around menopause and sex?
Well, I think every woman, of course, is different. I've had patients that start to notice low libido once they have children. There's so many factors that affect our libido. It's psychological, physical, stress, fatigue. But specifically estrogen, when the vagina has less blood flow or the vulva has less blood flow, orgasms can be less intense. There can be less interest in intercourse due to those physical symptoms of not having as good of a sexual experience, and that can be from less intense pleasure. So then, as you mentioned, more increased discomfort. So again, estrogen really plumps up the lining of our vaginas and our vulvas, provides lubrication, and so really it, probably by 45, I would say most women are starting to notice, gosh, I don't get quite as lubricated. Sex is a little bit more uncomfortable, or I need extra lubrication, artificial lubrication in order to enjoy intercourse. Certainly around 50 and older, as our estrogen levels decline significantly and we stop having periods. So once we're in menopause, we're not receiving, or we don't have as much estrogen in our bodies, what we call endogenous estrogen, so what our bodies are making, again, leading to uncomfortable sex and then oftentimes avoidance of intimacy with their partners.
Yes. And with, the loss of estrogen and how it affects our sex, we also experience just overall our behavior. And that's what I love about Gennev. And Jill, I'd like for you to articulate a little more about how you're looking at the women from all angles. And so kind of tell us what you do with cognitive behavioral therapy and how that's important with women as they're going through menopause.
Absolutely. I think one thing when we started Gennev, so we have lots of education at gennev.com, just for women who want to read up on information. It's medically reviewed by our medical team. And as we built out a telehealth practice, we started recruiting, really a team of OBGYNs that could provide medical consultation, prescription support when that's appropriate for women. And we've really built that out in 49 of the 50 states. So seeing patients through telemedicine in all those states. But as we continue to serve women, many women cannot receive hormone therapy or any kind of prescription support. And I think that's much of the audience that you might treat as well or support with Joylux and with your products. So we really rounded out our team and built out a multidisciplinary team with Stasi and her team to work with our clinicians so that every woman is working both on getting the medical care she needs, as well as making the lifestyle adjustments that are warranted around nutrition and sleep and movement and mindfulness. And the technique, and I'm going to pitch some of this to Stasi because she's actually the practitioner around using cognitive behavioral therapy and how we really have sourced our health coaches with that type of training. That is Stasi's core competency, and she's built out that discipline in our business. So Stasi, I'll pitch it to you to kind of talk a little bit about CBT and how do women think about that in their menopause care, and maybe give an example of how you and your team are working with women on that.
Absolutely. Yes, I think this is a great technique that we've been able to bring to our clientele. And the first thing to start with, so cognitive behavioral therapy has, I would say, there's a continuum of ways to use this, and we've tailored it specifically to women in menopause. The one thing I do want to clarify is that there are times when cognitive behavioral therapy is used more in a psychotherapeutic way, which is when women need that additional support from, post-traumatic stress syndrome or more involved psychotherapy. That's different from what we're doing. So there are times where there's more in-depth needed. What we focus on is really helping women to understand the connection between their emotions and their thoughts and their behaviors as it relates to menopause symptoms specifically. And we have found research wise that there are a lot of that when we look at menopause as the big picture and all of the factors that go into it. And Dr. Sarah, you touched on, even when we're looking at libido specifically, there's so many different factors. Estrogen certainly plays a role, but there's other factors there. And we find that with all sorts of lifestyle behaviors during this phase of life when women are changing, they're often feeling uncomfortable. That discomfort triggers negative emotions and negative thoughts that can sometimes fuel that process of discomfort. So, by helping women to identify that and identify those emotions and thoughts and behaviors, we're then able to, I like to think of it as if the wheel's going in one direction, the cognitive behavioral therapy approach puts a stick in the wheel and stop there so that we can turn the direction and help women to reframe and to identify those connections, and then be able to start to implement behaviors that are more supportive of helping them and managing their symptoms. So an example, one would be around sleep. We get a lot of women that their sleep is disrupted with the changes in hormones, and certainly the hormonal changes, fluctuations, disrupt some of the sleep chemical or sleep chemistry that happens in our brain. And what we typically hear from clients is that they're able to fall asleep, but then there's the 2 a.m., 3 a.m. Those are the typical times that they're waking up wide awake, their brain turns on, and they can't get back to sleep. So, using cognitive behavioral therapy, they can identify that often part of what's preventing them from getting back to sleep is that the thinking of everything they need to do and the fact that they can't get back to sleep. So we help women to identify that thought as being not productive or supportive. And by acknowledging that, giving themselves compassion and recognizing that they're not doing anything wrong. This isn't something that is their fault. It can turn down the volume on those negative thoughts and often ease that anxiety or that stress or that guilt or shame that they might be feeling, and in turn can support them in either falling back to sleep or at least being able to get to a place of rest, and recognizing that that still can be supportive and helping to manage their symptoms. So that's one example. There's a lot of different ways we can use this with women to really help them identify where their thoughts are not supporting them and how it's playing a role in exacerbating some of those menopause symptoms.
Well, that's actually very fascinating. When we think of treating women and giving them the tools,
Mhm.
we generally have a pretty good idea of, okay, if you do a VFit or if you do HRT, if you do something, usually you'll see with results within X amount of time. In this kind of treatment, what does the general path look like for one of your you call them clientels or patients? What does that
Mhm.
look like? Is it within 4 weeks you're better, or is it kind of like a lifestyle, change?
So we see the most impact over 3 months or 12 weeks, where women are coming in, they're engaging with and especially in our integrative care plan, they get appointment with a physician. So they have a consult with a physician, and then they're meeting with a dietitian, health coach every other week during those 12 weeks. So about 6 visits. And then in between those meetings, the phone meetings that they have text communication, which really helps to provide that supportive accountability, that continuity of care in between those calls. And that's where we see that time frame is when women really have that opportunity to explore their symptoms, look at the different options and behaviors, thoughts and emotions that might be connected to that big picture, and then implementing the lifestyle behavior changes with support over that time. And then that's typically when they start to notice a difference in how they're feeling.
Oh, that's great. As we all know on this call, that menopause is a long journey from perimenopause to postmenopause. When Stacey, I'm going to just do another follow-up question. So, when your health coaches, are working with women through this, is this something that is it within that 3 months they'll have a pretty good handle, or is it something like for the next 8 to 10 years you're working with one of your clientels to help them as they're managing this menopause journey?
That's a great question. So I see our clientele tends to fall into different buckets around that. So we have a group, like I said, the majority after that 3 month time period start to notice benefits or feeling better in their symptoms. And we have a group of women that after that 3 months say, you know what? I have what I need. I've gotten what I've needed. I've gotten these skills, lifestyle behaviors. I figured out the plan that works best for me right now. And they go off on their own and they're off. They're off and running on their menopause journey, wherever they are in that. We have another subset of women that say, and literally, we had one of our clients say this the other day. I've done the 3 months and I don't know why anyone would leave. I'm feeling so good. I need this to continue. I want to have that support. And I think there's also something to be said for knowing that you have that support just a text or a phone call away because so many things happen and are changing so rapidly, especially during that perimenopausal phase. You want to be able to know you have someone that you can say, hey, this is different today. Can you support me in this? So we do have then another subset of women that stay on. And then we also have a subset of women that will just stay on for a little bit longer so that they're not that indefinite subset that, want to have the resource for the rest of their menopause journey, but some that say, you know what, I've made this progress. There's a few more things that I want to fine tune and become confident in, and then they're on their way. And they typically will need another 2 to 3 more months in terms of feeling better or more supported on their journey.
That's great. It's nice to know that they have that resource.
Mhm.
Kind of following up on that, I'm going to turn it over to Dr. Sarah, and I want to ask you a question about just this whole phase of menopause. I was on a Facebook chat recently, and a woman asked, when does menopause end? And I replied kind of funny, like, honey, it never ends. To which she was very surprised. She thought there was a start and an end, and then we're done. But Dr. Sarah, talk to us a little about when is it really the height of the changes that women are going through, or is there a point in time in this journey that is most noticeable for us women, or is it just kind of like you just deal with it for ever? Like when do you say is where you have to be most aware of menopause?
That's a good question, and I think I'm going to give an answer that might be somewhat frustrating, but it's so dependent on the woman. So I've had patients who have breezed through perimenopause, started having irregular cycles, didn't notice a hot flash, and they just think, gosh, this is nothing. And their periods stop, and then the next 6 months are terrible. In terms of hot flashes and really trying to figure things out, where I've had other women at 42, I have hot flashes, I'm miserable for a few, for a few years. So it's very dependent on the woman, but I would say, generally speaking, the transition, I hate to put an age to it, but I would say the transition for the average woman who goes through menopause around, meaning stops having cycles around age 52, I'd say the average woman is noticing, if they're paying attention, some symptoms by 48, let's say. So, gosh, my periods are getting closer together, or wow, I'm really anxious after my ovulatory cycle, after I ovulate, and right before I have my period, my PMS is getting worse. That's absolutely perimenopause, and I find that is a symptom most women are not paying as much attention to. They're aware of it, it's bothering them, but they're not making the connection. So let's say if we did, again, general ages, 48, definitely starting to feel significant symptoms, especially with mood and period changes, perhaps hot flashes or night sweats during the week of their period. All these things are indicating those changes in our hormones. I've also had lovely, wonderful 70-year-olds who have said, I'm still hot flashing. But just to reassure everyone, that's very rare. That's not very common. So I would say there's an intense period, somewhat, again, depending on the woman, somewhat intense period, somewhere between 45 and 54. And then most women are sort of in a new phase, in a new stage. And hopefully they've, tapped into resources that Stacey's talked about, and been able to manage their symptoms and thrive in the postmenopausal state, because at that point things are somewhat stable in terms of hormones, and hopefully women have gotten on a regimen, whether it's medical or lifestyle approaches, that they're managing this new phase of life. One thing I wanted to say about what Stacey has mentioned about CBT and sort of encouraging women to slow down. And I think what the program that you are offering with the CBT is you're allowing women space to say, hey, what is going on with my body, my mind, my spirit right now? Let's take an assessment and tackle these issues, one by one. But it's really just giving ourselves the time and the space to think about ourselves and think about what we're going through, and then figure out the management that we need. And oftentimes I feel like the management can sometimes be the easier part, because women have such a difficult time slowing down and paying attention to ourselves. So I'm really glad that I think that CBT program is wonderful in that way, and it provides that opportunity.
Yeah, following up on that, Jill, I'd actually love for you to talk a little more about your integrative approach to managing menopause, because I love that you look at the CBT side, as well as, whether it's hormone replacement therapy or supplements or just other support. So why don't you walk through your approach at Gennev?
Absolutely. We've used this term integrated care. We believe in treating the whole person. And basically we know that menopause is not necessarily, nothing's like medically wrong with you. But there's obviously medical solutions to what you're challenged with, as well as lifestyle changes that you'll more than likely need to make. And I think understanding, the first thing, and I love what the CBT work brings into this whole awareness, is awareness of the self and all the change that you're going through. And if we stepped up to just be an online clinic, I don't know that that's advancing a new standard of care for women in menopause in a way that fundamentally changes the way women's health in post-reproductive years is treated. We want to kind of catch women at the start of this transition in our lives. We have a whole nother half of life left when we start to enter perimenopause, and equipping women not only, again, with medical guidance, but also lifestyle change support and awareness and education, because we get none of that education growing up typically, is at the heart of our integrative care model, and the fact that we've got multidisciplinary team members supporting women. Our vision is to grow old with women. And so while your perimenopause and menopausal change during life is the kickoff to that phase, we know that a lot of what you do during this phase, whether it's prescription, like HRT prescription, if that's right for you, or whether it is, really a shift in your nutrition, or a change in your sleep patterns, or really how you care for your vulva and your your vagina skincare routine, that all has such an impact towards the future. It impacts your long-term sexual wellness and viability. It impacts your long-term cardiovascular health and your brain health and your bone health. And so the more that we start to change behavior earlier in a woman's life, in her 40s and in her 50s, that just is raising the standard of care for women that just hasn't existed. And that's at the heart of our mission and why we exist. So the integrated care approach is just absolutely, I think, so crucial to this type of care for women. And, to date, we're pretty active about asking women if they feel better. 94% of our patients report an improvement in their symptoms after working with our clinician team. Some will work only with Stacey and her team. Some will work with the doctor and the coach. Some will only work with the doctor. And again, it really depends on what she needs, the kind of care she already has in place. We're not here to replace any existing care that she might already be receiving. But our multidisciplinary integrative care team is just there to support her where she's at.
I love that. I'm pretty fortunate, because if I ever have a medical question, I call Dr. Sarah. So Dr. Sarah, help me. But Jill,
I'm on the line.
most women, you don't have your Dr. Sarah. So kind of just walk me through exactly how the program works. So if I'm new to Gennev, what's the first experience? Stacey talked a little about the 3-month program, but what's day one look like for me? Who am I talking to?
Absolutely. I think for any woman, we recommend first take the menopause assessment. It's free. You go on our website, gennev.com, GENNEV.com, free assessment. Understand where you're at in the journey. We've chunked it out into 5 types, and it'll help explain to you why you're experiencing the symptoms you're feeling. Number 2, day 2, after that is our healthcare team will consume that assessment. They have access in our, employee record, which is HIPAA compliant, access to that. So you hit the ground running. When you book an appointment, you can book an appointment online at our website. When you put in your location, it serves up the right clinicians available to you in the state that you're in. And we always recommend first seeing the doctor, simply because that individual will give you broad scale medical consultation. And then when you do, sign up to work in an integrated care plan, also with a health coach on Stacey's team, that clinician and Stacey's team are sharing medical notes so that, again, you're not needing to relay the detail between the 2 different providers you're working with. You've got a team that's already doing that on your behalf. And so we always recommend take the assessment. It's free on the website. Sign up for an account. That's free too. Book an appointment with the doctor first. And then we really recommend, if it's right for you, to sign up for an integrated care plan. Integrated care plan's $85 a month. It's reimbursable by most insurance plans. We will help give you that paperwork to get it reimbursed. And also our doctor's appointments as well are reimbursable. So kind of 3 easy steps. And then we've got a patient coordinator team that will follow up with you, make sure you're just navigating the system right and you're getting the care you need.
I don't know why any woman wouldn't do this. And if you stay till the end of this talk, we will have a promo code to help you get started. So I want to shift gears a little bit, and I want to talk about my favorite topic, sexual wellness. It's so important to overall women's health. It's often ignored because it's been considered taboo for so long, but we're starting to see a real shift in how women talk about sexual health. So I want to shift it back to Dr. Sarah, and I want us to talk a little. You mentioned the effect of estrogen on low libido and painful sex. Let's talk a little more about what should women be doing if they're experiencing sexual wellness concerns or sexual, medically speaking, we call it sexual dysfunction, but, for all of us, it's not working the way it used to. So talk to us about what we could be doing.
Right. Well, I think that what Jill mentioned is one, I do think it's important to talk to a provider first. And it can be difficult for women to be able to open up about that subject. But most healthcare providers are open to the conversation, at least. I should say in my mind, I would hope, right? But as an OBGYN, absolutely, that is part of our repertoire of speaking with our patients. Sexual health is, part of our lives and very important. So I think talking to a provider instead of, just finding help on the internet, I would just discourage people from doing that, because if you're having painful intercourse, maybe you have an infection. Maybe it's not just a vaginal estrogen issue. So talking to a provider can be important. However, let's say a person is not interested in talking to a provider first. Thinking about lubrication, like thinking about an artificial lubrication, thinking about how we care for our vaginas and our vulvas. Are you using soap, which can be very drying and make symptoms worse? Are you treating your body with clean products? Are you paying attention to your body from that standpoint? Also very important. Same with lubricants, is making sure that they're clean and safe. As a provider, I'll speak with my patients, of course, about vaginal estrogen and those options. Vaginal estrogen is a great option for many women, but oftentimes women are not interested in using hormones, and that's fine. So more natural remedies that are still very safe and effective would be, of course, BFIT, which is what we've designed and worked with for years now. I've had many patients tell me that BFIT, after about 4 to 6 weeks, has reduced their discomfort, has increased lubrication and blood flow to the area. So it can make sex more comfortable, but it can also make sex more pleasurable, because you're thinking about two different things with sexual wellness. I think one, comfort is of the most important in my mind in some ways, because you won't be able to have pleasure if you're not comfortable. So increasing the lubrication and having a increase of the thickness of the vaginal tissue will make sex more comfortable. So VFIT is very effective from that standpoint. CBT, I think thinking about talking to a provider about CBT for sexual wellness is really important, of relaxing your body, being able to be in a more comfortable mindset and body place before you initiate sexual intercourse or sexual play. That can be done with a pelvic floor physical therapist. It can be done with a therapist. It can be done with Stacey's team. So that's another important component, is addressing the mind when it comes to sexual health. And then partner issues. I think it's really important to communicate with your partner about what you're experiencing, being able to, problem solve together. Women often feel pressure to please their partner and therefore, suffer more discomfort than necessary. Other women choose to just avoid the sexual arena completely, and then that isn't great for a partnership. So those are sort of the things that I think about, is can you use a hormone? Can you use BFIT? How are you addressing your sexual function from a mindset, and how's your body functioning, and how are you treating your body and your relationship?
Those are all very helpful, Dr. Sarah. One of the things that I want to focus on is this notion of talking to your partner. I think many times when we are having sexual discomfort or issues, it's embarrassing to bring it up with your partner. They can sometimes get, defensive, like, what, it's me, what's wrong with me, or it's just embarrassing talking about what you need. And so I'd love to hear from Gennev, whether it's Stacey or Jill, some thoughts on how you can help start a conversation with your partner about sexual wellness, or what you want, or how to make it better. So if you could give us some pointers or thoughts around that.
Absolutely. Jill, do you want me to go first, or?
Go for it, Stacey. You're the one you're working with patients, so you're absolutely.
All right, I'm happy to take this one, because this is a topic, and this is a great intersection where we do overlap with our OBGYNs, and our situation where that integrated care plan is key. Just as Dr. Sarah mentioned, there are certainly situations where medical attention is needed, and you want to make sure that that is all taken care of first before we're talking about the behavioral things. Because if you jump into the behavioral things without addressing the underlying medical concerns, then you're not going to be able to get as far along in your sexual health and wellness journey during the peri to postmenopausal transition. So in that realm, we will, as health coaches, we will talk with our clients about what their main concerns are in different ways. A lot of times it's education. I think coming back to this sexual health arena, we haven't had the opportunity to be educated on what our needs are as women. I mean, many women don't know that they need more stimulation for arousal and orgasm than our male counterparts. And so we automatically think that, oh, if we're not getting aroused in the same time period as our counterparts, and that could be male or female, if there's a difference there, then we think something's wrong with us, when in fact it's learning how to address our needs. So that comes back to that CBT aspect of what do I need now in this space? And this space during that peri to postmenopausal transition is new. And it's okay that, helping to reassure women, it's okay that it's different than things were 5 years ago. Your body's different, your physiology is different, and this is a time of exploration. So often we approach it in that way, to say, hey, this is a time to find what works for you now and your partner, and how can you have that conversation with them, and what are the skills to do that. Often, more often than not, we practice, and sometimes in our calls, we'll practice with women a script for them to bring to their partner to say, "Hey, I'm experiencing, I'm in perimenopause right now. Can I share with you some changes that I'm experiencing?" More often than not, the partner is really happy to hear those things because they don't know them. And then once they have that understanding, it breaks down some of those communication barriers, and then you're able to embrace what is the next step for your sexual relationship. And that could be exploring new positions, it can be exploring new ways to pleasure each other, it could be using different devices or sex toys that can be helpful. And then once it becomes fun, once it becomes this exploration and an adventure, you are changing that whole trajectory of it. And then women can start to embrace this new phase of their sexual health. So that can be the way that we support them. Oftentimes, we're also recommending educational resources. Dr. Lori Mintz has been on our podcast, and we have a YouTube video with her, and she is a sex researcher and therapist. She has some books out, Becoming Cliterate, and so we often recommend some of those resources as well to help women empower with education and then have their own exploration process supported, and then coming back and they can ask questions and then really helping to direct them when, all right, now this is an area where you may need to revisit a practitioner, a physician on the OBGYN side to, if there's something that comes up in that way. But most often that just opens the doors for a lot of women to explore.
Now, I'll add one more additional aspect of how we're supporting women in their sexual health. To Stacey's point around education, a lot of women, again, there's no what to expect when you're going into perimenopause for women. And so one of our clinicians, Dr. Lisa Lowy, has created Menopause Foundations, and it's a 4-week program. It's group care, essentially. It's a small group. It's up to 10 women in a group. And there's 4 different sessions that you have. It's OBGYN led. And one whole session is dedicated to desire, libido, and sex. And there's a lot, they go deep in, again, the safety of a small group of women, talking about desire. And, have we ever thought much about desire? Because that tends to not be something that we're encouraged to have. And now that you're at this point in life, how do you think about it? How does it manifest itself? How do you even identify what you desire? And so they're really taking the conversation to that level with women in a safe kind of virtual education programmatic sort of way. Again, that enables women to kind of think through, what are the questions I should even be asking myself so that I can start to have that conversation with my partner. And it's really proven effective because there's sometimes they don't necessarily go into role playing. But again, when you're hearing just things that might trigger your own thinking, or like, oh yeah, I've always felt that way and I didn't realize that was holding me back from doing this. That's what kind of that programmatic kind of education is all about, to just help women kind of sort through, what do they want? What do they even want from their sexual well-being and their relationship with their partner? And then how do they bring that up?
That's awesome. Dr. Sarah, do you have anything to add in terms of, advice on how to start that conversation with your partner, or how to, get the most out of that relationship?
Yeah, I think I was thinking when Stacey was talking, it can be, I think for a lot of women, it's a very personal thing, even though they may have been intimate with their partner for years, or maybe this is a new partner, but regardless, it's a very personal, intimate thing, our sexuality is, and we share it with others at certain points, but it's very personal to ourselves. And I think taking the time again to be with yourself and think about what are the issues, and trying to withhold judging about it, because there's oftentimes this mindset, which again the CBT could help, of, oh, for example, my vagina is more dry, oh no, I'm getting old, oh no, my partner's not going to want me. It can just spiral for a lot of women. And so I think really taking the time with yourself, if you can, to not let it spiral, but being with yourself first about it, and then being comfortable and accepting where you are, that this is just what's going on, and there are solutions, and it's not all doom and gloom, can provide a more positive conversation with the partner and a more confidence in going into the conversation with the partner. And you don't know what your partner is experiencing. Maybe they're also having issues as they're getting older, or depending on the situation. And so I think just having an open mind and a compassion for yourself and your partner is a good place to start.
All really great advice. Jill, you mentioned about your program about the small women, groups of 10. I find just being with my girlfriends, how helpful it is being talking about sexual health. I would say almost every conversation now when I'm with my girlfriends and we're out, having a glass of wine or at someone's house and spending time together, sexual health comes up, which is good because it means that as a society, we're breaking down those taboos, we're talking about it, we're sharing. It's all very normal and it's all very important to having a well-rounded life. Sexual health is vital to overall health and well-being. So with that, we've talked a lot about, inside the vagina or vaginal health, but there's this whole, and Jill, you kind of teased it earlier when you said skincare for your vulva. Let's talk a little about that because, as women, and I spent the majority of my career in skincare. So I know how important it is for us women to take care of our face and how we look here, but it's equally important to take care of our skin down there too. So Dr. Sarah, I'm going to hand this over to you first. And I want you to talk a little about, first of all, let's make sure people understand what the vulva is and how that's different from the vagina, and why caring for the vulva is as important as caring for your face.
Yes, really good point. And I love that we're using correct terminology, because I feel that women have been taught to not address their body parts correctly. And I'm okay with nicknames and things like that, but certainly differentiating between the internal structure of the vagina, which is a muscular tube, versus the external outside structure of the vulva, which is composed of skin tissue and then other more delicate tissue. So oftentimes, women will say their vagina when they mean their vulva, and vice versa. The vulva many times is a really big hot spot for the changes of perimenopause. It's not necessarily vaginal. Sometimes women will say, oh, I'm a little dry with intercourse. But most often I notice women are saying, gosh, I feel dry outside. That's where I'm a little irritated. That's where I feel itchy. That's where things are bothering me. So I think being able to differentiate that is very, very important. The vagina, when we talk, you'll read on the internet, the vagina is self-cleaning. And what that means is you actually don't need to wash inside your body. You don't need to put anything, for example, douching, which used to be done a long time ago, or soap inside. The vagina is, when it's healthy, and that's based on lots of lifestyle factors, but in general, when it's healthy, it's a great self-preservation organ. It keeps pH where it needs to be. It keeps lubrication, if again, we're addressing lifestyle issues and perimenopausal issues, right where it needs to be. The vulva is a little bit more finicky and more delicate and sensitive, and most women don't want to ignore their vulva in terms of cleaning it. Colette and I have our funny conversation all the time that she would say, how do I clean my vulva? And I'd say, with water in your hand. And she would say, no, I want something more. Like, I want a soap.
I want to feel fresh down there. I want to
and I get it. I understand that. Women can be,
roses.
I know, women can be very sensitive and self-conscious about their odor. And we talk about there's lots of natural odors, but anyway, that's a whole nother conversation. But I do understand that women like to clean the outside, the vulva. And so Colette and I created a great line of products that are safe and clean, and a non-soap soap that smells delicious that we can use on these parts of our bodies safely. But really the point is the vulva is sensitive and delicate, does experience a lot of symptoms in perimenopause, and we need to treat it carefully. And that goes back to what I was saying earlier about clean products, no parabens. Parabens are heavily related to breast cancer and other types of cancer. no phthalates. There's a whole list of ingredients that can disrupt the bacteria, the healthy bacteria on your skin, and be absorbed in unhealthy ways for our body to have to process. So that's what I would say about the vulva and the vagina. How's that, Colette?
Yeah, we've had, Dr. Sarah and I have had lots of debate on this because I do want to feel fresh and clean, but it is a very delicate tissue. And so when we designed her intimate care line, we made sure it was pH balanced, that it was all clean ingredients, but still you left feeling fresh and hydrated. And in fact, when I first met Jill many years ago, oh my gosh, Jill, it's so long. You also have a wonderful line of vulva care products as well. Maybe you want to share a little about those as well.
Yeah, well, thank you. We're just kind of right aligned. It's got to be pH balanced, no phthalates, parabens, and clean, and doesn't irritate. Only just helps you maintain. So likewise, we've got lubricant products as well as a pH balanced cleanser that's kind of a non-foaming cleanser, odor-free, fragrance-free, I should say, and safe for when you feel like you want a little bit more freshening than just water in your hands. So totally echo all your words of wisdom there.
Yeah. Now, if you want to take Dr. Sarah's advice and just use water, fine. But if you like Jill and my advice and you want a little help, try one of our products. Whatever you do, though, don't use just normal body care products because they generally have a very high pH and they are very irritating and can often lead to more problems. So really, it's very important you stick with something that's pH balanced, clean, and non-irritating. All right, ladies, so we're getting close to our time, and it's been really awesome. There is an audience question. It's about Gennev and all that support for one low fee. And not only is their fee low, we're going to give you an opportunity to start with even lower. So if you are interested in the signing up for the Gennev program, they have an awesome integrated care plan, and you'll receive 50% off your first month. 50% off. Wow. Like 50, folks, that's a lot. So use the code Joylux50 when you sign up and you'll get 50% off. But you know what? I think even if there was nothing off, you must sign up for this because it's an amazing program that women need. We need all the support we can get. This is a challenging time. And to know that you have someone like the team of people at Gennev to support you is really critical. Now, if you'd like to try the Joylux products, we also offer a great discount, 15% off. It's called Joylux Live. And you'll get 50% off any of our products. So our V-Fit, which is the red light intravaginal device that helps rebuild that collagen elastin, increase that blood flow to really help with things from sexual health, sexual wellness, to better control. So try the V-Fit with 15% off at Joylux Live or any of her intimate care products. So with just a few minutes left, I want to turn it to Jill because Jill and I have known each other now a long time. We were, as I mentioned early on in the call, we are probably the earliest pioneers in this whole category of menopause. So let's just shift gears real quick and talk about just the business of menopause. It's been hard for us. There's been a lot of obstacles. What would you say has been the most challenging thing you've had to overcome, Jill, starting Gennev and taking it to where it is today?
I think the hardest thing for me to watch and accept and even kind of deal with, and Colette, I'd love your thoughts on this too, is menopause impacts every single woman. And the majority of women do not just sail through it. We have all sorts of symptoms. And so when you think about the market, it is massive and there has been little to no attention. on this part of our health, our education, our care provider education, the products available to us. And so when I started the business, I thought, we're bringing something that women need, and it's a massive market. It's just going to take off. And it's really hard growing, I think, a menopause market. Part of it is we're changing a whole mindset of women who have never received care or been prepared or known what to expect. And so we spend probably the majority of our time educating first. And that's part of a lot of why we publish a lot of education. A lot of women just find us because they're online searching, they're going to Dr. Google. And so we think if we can intercept them there, let's at least bring medically backed education to them. But I'd say, Colette, for me, just the, really changing women's mindset and reaching women in mass to show them what's available to them is probably the hardest thing about this. What do you think?
Yeah, well, I'd say let's start with the word menopause. I think people automatically assume if you're going through menopause that you're old. And when I say old, they're like, oh, you must be in your 70s, 80s in menopause. No. It starts early. And I will be sitting around with my girlfriends. We're in our mid 40s, late 40s, and they'll start sharing with me things that they're going through. And they'll be like, oh, I just must be stressed. I'm like, no, honey, that's perimenopause. You are going through menopause. That's the whole point. And so I think just, again, educating women on what it is, what menopause is, what is perimenopause, when do we experience it, what are the symptoms, and what are the tools and resources. When I, from a business perspective, it's challenging because, there's a lot of misconceptions about women's health. Talking about sexual health has been very taboo, even though, oh my gosh, we've been talking about erectile dysfunction since the 90s. Do you remember Bob Dole and the ED commercials of the 90s? So it's about time women, we have our, it's okay to talk about sexual health without it being pornographic or without it being, something bad. Sexual health is awesome. It's, again, part of what makes us women, and it's important that we thrive, have a sexual active life when we're in our 40s, 50s, 60s, and on up, because that keeps us young, it keeps us alive. So just trying to break down these taboos, whether it's menopause or sexual health, that's been the most challenging. And then just, again, reaching women, this impacts everybody, but we need the platforms like the Facebook platforms, the social platforms, Google. We need them to allow us to talk about women's health in a way that helps us reach everybody, because there's so many things that, Jill, you and I know we cannot say. We can't in a Facebook ad talk about menopause, will get us shut down. So how do you work around that? There's lots of challenges, but it's so rewarding. And I'm sure Stacy, Jill, Dr. Sarah, you all have stories on how you have helped women. So with that, if there's any last parting words you want to share with these women on, to let them know you're not alone, there's help, there's things you can do, there's people you can talk to that will really help change your life. So if there's anything you want to add, please do.
I wanted to say one more thing about just women at this phase of life, which I think is helpful when we talk about holistically approaching our patients or our clientele, is that the wonderful thing I find about perimenopause, not only for myself, but in my patients, is that women are oftentimes kind of finally coming into their own and realizing their power and their confidence. You start caring a lot less about other people and their thoughts, and you just kind of come into your own. And so I always feel a little uncomfortable when menopause is approached with, oh no, age, doom and gloom. I like to think about it as just a flower that's reblooming and is taking on a different approach at looking at the sun. And I just really think it's a wonderful time in life for women, and whether it's with the CBT or having other women tell you that this can be a really fantastic time in life and a wonderful time in life to pay more attention to yourself and start doing the things that you really are interested in doing, and taking care of yourself, #1 priority. So I just wanted to leave with a little hope and optimism about perimenopause and menopause.
Yeah, you know, I want to just not take the temperature down, but keep it going up, Sarah. I love that. I also encourage, you know, I've been working in menopause now 6 years, and I continue to learn new things about what to expect and what's happening in my body. And Stacey and her team will be in our channels talking, chatting about something, and I'm like, I didn't know, you know. So I guess my message is, even if you feel quite equipped and like, you know, continue to seek out, continue to seek to understand and learn. It is a vibrant time of our lives, and there's just increasingly more education. There's more companies like Joylux and Gennev coming on the horizon talking about menopause. There's more resources. So seek it out. You know, there's so much you could be doing for yourself.
Great. Stacey, anything you want to add?
I'll just add on to that. I love how Dr. Sarah set the stage of this being an opportunity. I think that shift for women to help them understand that they haven't even reached their potential. There's new potential for them to see. So how can we look forward to what possibilities are versus wanting to go back to what was? And in that same piece of helping women to recognize that there's a lot more to be had in this realm, and to reach out when they are uncomfortable. And it's not about, oh, I'm going into menopause and being positive every single day, and oh, this is the best time of my life. It's recognizing that days may be hard, and that's okay. And you can get the support during that time. So it's also learning to be comfortable with the discomfort in a new way, which takes a lot of practice, and it's not always comfortable, but there's support to do that. And when you see women come to the other side of that, it's amazing to see what potential they can reach. So that's really motivating, and I want that for all women.
Great. Well, again, ladies, thank you so much for your time. And just to wrap this up again, we have a 50% off your first month of Gennev if you use the code Joylux50. Again, you should be doing this no matter what, with or without the discount, but 50% surely does help. And then at Joylux, experience one of our awesome products at a 15% discount using the code JoyLuxLive. So thank you, ladies. Remember, this is just part of a wonderful journey that we're all on. And there's the tools, the resources, and the people to support and help guide you through this time of your life. So with that, happy journey. Take care.
Thanks. That was great.
Bye.